Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Friday, January 22nd, 2021. At the moment, it seems that cases are either plateauing or possibly even on the downward trend. This may just be comparisons to when we were getting backlog cases for a while, but it does appear that we are turning downwards across the country. Deaths, however, are continuing to trend up, as those are a trailing indicator. Deaths generally follow the cases by a couple of weeks. Looking at this graphically, as you can see here, testing still remains fairly high, slight dip there, but case counts are way down. And this isn't just a holiday effect from Martin Luther King Jr. Day on Monday. It looks like perhaps we are going to be seeing a little less. Of course, means we should never get complacent. We still have the highly transmissible B.1.1.7 variant in the country right now. So there is always a possibility of a spike in the future, or if people start to let their guard down. But very reassuringly, hospitalizations are also down, which is the one marker that is not affected by holidays, by backlogs. Hospital numbers are generally pretty accurate to the time they come out. And just looking at these as weekly scales, you can see where this past week is a significant drop from where we've been for a while. Like it's the lowest we've been, except for the actual Christmas holiday week, which of course had a lot of data reporting irregularities. So that is encouraging. But more importantly, this hospitalization trend is down for the first time since, September at this point. Yikes. So that is very encouraging, but of course that is still a long way to go. Remember, we shouldn't start to let our guard down just because there's only 120,000 people in the hospitals. But reassuringly, looking at the trends, we can see that generally speaking, hospitalizations is trending down across the country or staying even. In fact, I've got a slightly more up-to-date one here. It shows that since last week, the only 2 states did not have an overall reduction in hospitalizations. Unfortunately, one of those was Massachusetts, where we stayed even, and New York was the only increase. But looking across the country here, you can see everything from a week ago is slightly down, some significantly, generally in smaller areas where they can swing more, like up in Alaska. But even just a small percentage in any of the bigger state like Texas is still pretty good. And just looking at how the hospitalizations have gone over the last couple of months, this shows the average, the net hospitalizations on any given day, with the purple ones being when there was an increase in hospitalizations and the blue being a decrease. And so there's an average line here for each month where we've been increasing, steadily, so even if the number trends down, if it's still above the line, we're still getting a net gain in our hospitals. But so far this month, it's the first time our average has been negative, which is very exciting to get a little bit of pressure off our hospitals right now. In terms of deaths, however, January is the second deadliest month of the pandemic, and we still have almost a little over a week left to go. So we should expect to see plenty more there. There are new estimates saying that by the end of February, we may have another 100,000 deaths. So that is not great. But there is perhaps a little bit more light towards the end of this tunnel. And it's still just a long road to get there. Here's looking at the deaths total over the course of the pandemic by state, by population. This is the number of people per million that have died in the country. And as you can see there, Massachusetts is the second highest in that, in deaths by population, New Jersey being the highest. But you can see a lot of that, of course, is still that early terrible phase of the pandemic in the spring, where us in the Northeast were hit especially hard. But you can see where other places have the Dakotas from that brutal wave in the fall. It's only just abating now. Arizona, which has been hit basically when every single surge has hit Arizona. And then also down here in the South, which we don't hear about as much, but significant death toll there as well. It's just a way to look at, because when the raw numbers can be somewhat deceptive when we are looking in a state that is particularly large or small, and this just kind of equalizes it around the country. So moving on to developments, a lot of big things in the work today. All of our developments are political. So because we have a federal COVID strategy coming out, starting on day one, President Biden unrolled a lot of new executive orders aimed at the pandemic. So we should expect to see a bunch of new guidelines coming shortly. A couple of highlights to pick out there is President signed an order for mask mandates anywhere that the federal government can enforce that, which includes federal buildings and lands. Also interstate travel, so that includes airports. Also pledged to perform 100 million vaccinations in 100 days. And this is something that, if we knew that by April, that is a third of the country essentially vaccinated. That sounds very ambitious because that does mean 100 million vaccinations a day. Lately, we've been doing about half that, so that is certainly an uptick. However, it does seem like an achievable goal and maybe perhaps something we should even push further than. Also, we have officially rejoined the World Health Organization with our representative to them being none other than Dr. Fauci himself. And that enhanced international cooperation is very exciting, as well as how there have been pledges to help global distribution of the vaccine as well. There had been some concern for some time that wealthier nations would be hoarding the vaccine, and that would leave developing nations in the lurch. So there is now perhaps a little bit more pressure towards correcting that, though we'll see how that actually plays out. Also, in terms of indirect pandemic, the eviction ban was pushed back to end at the end of March instead of the end of January, and student loan deferments have been extended through the summer. Just two more pandemic relief measures. Also, a pandemic testing board was established. This is kind of based off the World War II War Production Board to kind of make sure that testing is moving up to speed with adequate supplies, et cetera. And we should expect to see a lot of new initiatives in the coming days and weeks and see how those start to play out. So again, as I've said before, any new policies will probably take several weeks for us to see their effects in the numbers as taking effect, and then how that plays out through the virus transmission. It will be a little while there before we actually start to see benefits from any successfully implemented policies. Right, and for more from the MassSupport Network, first check out our sources, including COVID tracking for all those beautiful, beautiful charts. New York Times gives the raw numbers, and mass.gov has the Massachusetts-specific data. But for more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.